If you're someone suffering with chronic debilitating back pain or serious chronic neck pain, and you've been prescribed drug after drug after drug, then this video is for you. It's a multi-billion-dollar industry. Medical doctors prescribe these drugs all the time, yet people still have the pain, and often the pain is getting worse. It's time to break that cycle. In this video, we're going to talk about the 5 biggest reasons why drugs are not the answer. Please stay to the end. You need to know everything that we're talking about here today. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor. I have been practicing for almost 35 years here in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those suffering from debilitating neck and back pain who feel they've tried everything, have given up hope, and yet we're still often able to find a solution for them. Before we go any further, please smash that subscribe button if you want to hear more tips and strategies. I upload a new video every week. The number one reason why drugs are not the answer on our list of 5 biggest reasons is when it comes to painkillers, understand what a painkiller does is it masks the pain. It never fixes the underlying cause of the problem. If you've been watching the news lately, you're hearing a lot about Tylenol, so let's talk about Tylenol. This is nothing new, and I'm not going to give you an opinion of what's happening with Tylenol right now, but we have known for decades that not only is it just masking the pain, but what it does is it actually allows your condition to get worse. And you say, well, how is that? How does a drug make it worse? It makes it worse because it's not fixing the underlying cause of the problem. And if part of your condition or part of your underlying causes are conditions that are progressive, it's going to continue to get worse. What you also do need to know about Tylenol is the main ingredient, acetaminophen, is the #1 cause of acute liver failure. We have known that for decades. That is nothing new. I understand sometimes you want to think you're breaking that pain cycle, and sometimes the pain does get so bad. If you have to take it once or twice simply so you can get some sleep, then don't beat yourself up about it, but it is not a long-term solution. The second reason why drugs are not the answer for low back pain is when we come to anti-inflammatories. So now we're talking the Motrins, ibuprofens, Advils. If we're talking prescription, they could be the naproxens and Arthrotex and Voltarens and so forth. What they are attempting to do, bring down the inflammation, does make sense. The problem is they're not fixing what's causing the inflammation in the first place. And so people often get on to a lifetime of anti-inflammatories, and these anti-inflammatories have serious side effects. When I say serious, we know how they affect the stomach. We know they eat away the stomach lining. What you may not know is in Canada, 2,000 people die every year from taking anti-inflammatories. In the States, it's about 10 times that much, just under that. Last stats were about 16, 17, 18,000 people dying from taking anti-inflammatories. There were 2 scientists who looked at every study that had been done on the chronic use of anti-inflammatories. And when you hear something like that, you need to ask questions. You need to say, okay, what did they mean by chronic? By chronic, they meant anyone taking anti-inflammatories for 2 months or longer. Not 2 years, not 20 years, 2 months. So that's going to be anyone suffering with chronic low back pain, anyone with serious headaches, any woman with menstrual issues, a lot of people with arthritis and so forth. And by looking at every other study that ever been done, you know what the new death rate was? Was 1 in 1,200. Not 1 in 12 million, 1 in 1,200. If you've been taking anti-inflammatories for longer than 2 months, you have a 1 in 1,200 chance of dying from that. And yet you'll still go out and buy your lottery ticket with a 1 in 12 million chance of thinking that you're going to win that. Please, right? Short term, if you think you have to, much better to go to the natural anti-inflammatories, but let's fix the actual underlying cause of the problem and what is creating the inflammation in the first place. Number 3 on our list of the 5 biggest reasons why drugs are not the answer is when we come to muscle relaxants. So one of the issues is a lot of people often think their problem is muscular. It's one of the most common questions I get asked. Doc, is it muscle? Is it nerve? Is it bone? It's almost always going to be all 3 of them, because that muscle is controlled by the nerve. That muscle attaches to the bone. The bone can compress the nerve. So you're going to get caught in this vicious cycle. The reason people think it's muscle is because that's what you're going to feel. You're going to feel, you're going to feel the spasm, and then that's when you're going to put heat on there. That's when you try to stretch it. Often that's one of the worst ideas, putting heat on, because you always have to think underlying cause. So if the problem is if there's inflammation involved, why are you heating up an inflammation? But that's a different video for a different time. Other reason that this is not a good idea is you may see people who are so bad that they're literally bent over to one side. They may be bent forward, they may be crooked, the hip may be out of whack. That is what we call an antalgic posture, is your body knows what to do. It's just dealing with a lot of bad situations. So the reason you go into that antalgic posture if you're bent over is because the body is literally trying to pull you off the nerve on that one side. So if that's the case, why on earth would you go to defeat the body's own self-defense mechanism? Unfortunately, there are health professionals, doctors out there, they'll see someone come in like this and you'll say, oh, the muscles are really tight on this side, so we need to ease those up so we can come back. No, it's one of the dumbest things you can do. You're actually just trying to get the body to defeat its own self-defense mechanism and put pressure right back on that nerve. Muscle relaxants are never going to be the answer to solving any long-term problem or to give you any long-term solution. That brings us to number 4 on our list of the 5 biggest reasons why drugs are not the answer. So if those things aren't working, if you're not taking the painkillers and the anti-inflammatories and the muscle relaxants, then we get to the opioids. Unfortunately, you don't need me to tell you, you've seen this in the news, how addictive they've become, how serious these drugs are, the tramadols, the Dilaudids, et cetera, et cetera, et cetera. Did you know the biggest reason opioids are prescribed is for failed back surgery? So again, if we can do the things to even avoid the surgery in the first place, then we're less likely to get prescribed the opioids, and that's something that may save your life. These have huge repercussions for the rest of your life. Opioids, we know this, are not the answer. And number 5 on the 5 biggest reasons why drugs are not the answer, and you've probably never been told this, are those who go for cortisone or epidurals. So let's surprise you right off the bat. Did you know that epidurals, contrary to their popular use, have never been approved by the FDA for treating back pain? Bet you didn't know that. Go check it out. I know it sounds so bizarre because people believe that that's when it comes to the cortisone in my experience, having laid my hands literally on hundreds of thousands of spines, is a flip of the coin. So cortisone is meant to kill the pain and to bring down the inflammation. The problem with that is, again, it's not fixing the underlying cause of the problem. Number 2, they have some serious side effects. And number 3, what you're probably never told is repeated cortisone use will actually weaken the tissue. If you have the cortisone and it worked, you thought it worked well for you, great for you. But long-term, not a solution. And for a lot of people, it doesn't do anything for them. Sometimes, in fact, even makes it worse. And it's certainly not a long-term solution because you're weakening tissue. Those are the 5 biggest reasons why drugs are not the answer. And then one last thing that we haven't talked about, even with all those, think of the fact that a lot of these become addictive, if not almost all of them. Think of the side effects that come with all of these things. And really, side effect is a misnomer. It's not a side effect, it's an effect. And they have some serious effects on you other than what the drug company intended you to so-called benefit, from this. So what do? You find a doctor that you can trust, whether that's a chiropractor, a medical doctor, health professional, someone who understands these injuries well. That's not true of a lot of doctors. They will give you the typical, take the Tylenol, lose weight, stretch, and you'll be fine. And we know that's simply not to be true. Find a doctor you can trust, someone who understands these conditions well, someone who knows how to get to the underlying causes of the problem, someone who's not scared to say, I don't know. There's a difference between saying there's nothing wrong with you versus I don't know what's wrong with you. Those are 2 completely different things. So find someone like that. Don't give up. There is hope for all people. My 10th book that I've written, Low Back Pain is not a life sentence. You just need to know the appropriate approach to take. Please, if this is information that you find beneficial and you could help someone else, please like and share it. Please subscribe. The more people who understand this, the more people we can help. The next video that you should watch, please go watch this particular one that talks about disc herniations and the specific exercises you can do for that.